Hi, my name is Dr. Todd Rowe, and I'm talking about the homeopathic medicine Arnica Montana. Before I start, just to say that nothing in this material is meant to diagnose, cure, prescribe, or treat any illness. Please consult your homeopathic practitioner for treatment options. Arnica Montana is commonly known as the mountain daisy and is the most commonly used homeopathic medicine around the world. Its abbreviation is ARN. It's also commonly known as Leopards Bane. The remedy is made from a tincture of the whole plant. It typically grows on alpine slopes in mountain regions and originated in Europe, although it is found now in the United States. It was introduced into European folk medicine by shepherds who found that the plant was very useful in treating injuries. Pharmacologically, it's been shown that the plant can dilate the blood vessels and cause permeability of membranes. So how do we use this remedy homeopathically? It's probably one of our most important remedies for injuries, and particularly injuries with bruising. It's our first remedy to consider. So any kind of injury, it can be used, although it can also be used for mental injuries as well. Typically, you don't use this remedy for open wounds so much as wounds with bruising where the skin is not broken. It can be used successfully before and after surgery, and there is good research that indicates that Arnica can reduce the time that it takes to recover from surgery, and the remedy can be used either before or after surgery to do that. It's a great remedy for concussion and for sprains. It's also being used currently in the United States by a significant number of plastic surgeons to reduce swelling and bruising after plastic surgery. It's a great remedy for the long-term consequences of trauma. You can also consider this remedy for dental extractions and also for tendon or ligament problems along with rust toxicodendron. People who need Arnica Montana oftentimes are in a state of shock. And when you're in shock, like after a car accident, people walk around and they're bleeding and they oftentimes say they're fine. And so typically Arnica is in this sort of dazed state where they're saying that they're fine even though they're not. Conditions that can cause the need for the remedy Arnica Montana include any kind of shock, whether mental or physical. Also ailments from overexertion, like someone who's been out hiking all day can benefit from this remedy. Mechanical injuries, head injuries, also anger, ailments from anger can all respond to this remedy. They typically are worse from sudden movement, and there can be a fair amount of exhaustion, and they can be hypersensitive to both heat and cold. There can be sleeplessness from this remedy, typically around 3 a.m., and frequently yawning. People who need this remedy are worse from touch, worse from movement, worse from wine, worse from noise, and worse from damp, and better lying with their head low. It can be a useful remedy for eruptions, skin problems that are symmetrical on the body, and there tends to be a quality of putridness or rottenness to the discharges that come along with Arnica. Great remedy for the aftermath of head injury. In the ears there can be shooting pains. Useful remedy for nosebleeds along with phosphorus to help them stop. It's a remedy to consider for diarrhea with foul-smelling flatulence. It can also be used for women who are pregnant and going through labor, can assist in that. It can help control bleeding during labor. There can be a lot of pain, as I mentioned, with sharp pains down the limbs, and particularly pains in the muscles. And they can have trouble sleeping, feeling like the bed is too hard. The main remedy to compare to for shock is aconite napellus, also Apis mellifica. Another remedy that comes close that's more useful for abdominal problems is Bellis perennis, or daisy. Also Bryonia alba, Natrum sulfuricum, and Rus toxicodendron are fairly similar and can be compared to this remedy. You can order this remedy at orders@amchh.org, or if you're interested in learning more about this or similar remedies, you can find out about our acute care course at acutecare@amchh.org. Thank you very much.